See too much.
Listen, good.
I'm supposed to be a good guy. All of my place and I didn't tell you.
But they're back to quick. What's your favorite? You know.
I didn't tell you, brother. I didn't tell you.
What the animal? Because that fish there na for phone for night. That must be a bagasse.
There is nothing. Like imagine.
Orange. Que você gosta, né? Eu gosto disso. This back.
Don't even read that side.
Very happy. Thank you. Deixa eu uma cara.
My wife, Anugra.
Ah, you're a big boy now. 250K. Ah.
It is beyond scrapes and bruises. The idea of first aid we've always had is plaster in one small red box that has a plaster in it and then has bandage and all that. Someone cuts, they clean it, wash it, and then apply plaster. First aid is actually beyond that. You need to understand that your action or inaction can actually determine the outcome, whether someone survives or someone dies. It plays a huge role in determining outcome. In the 3 series of this course, you will have to understand. You will come to understand what I mean. Today will just be strictly handling medical emergencies. You also need to understand that many are dead before they arrive at the hospital because basic first aid wasn't provided. Those that watched the Euro 2020 that held this year, we were all witnesses to one of the players from Denmark who collapsed in the field of play, just like a regular field of play. He has undergone his health screening and he was fit to play. And all of a sudden, he's feeling woozy and then he slumps right in the field. You could see how promptly everyone responded, including the football players themselves. No one was left out. And luckily, the person survived. Cardiac arrest is only one of such medical emergencies, and that is what we'll handle in our last series because it's quite elaborate. But there are so many other things, and what you do or what you don't do, sometimes it could even be the wrong things you do that it may even worsen the patient's outcome. All right, so by way of definition, first aid is the immediate assistance provided to a sick or injured person until professional help arrives. It is an assistance. You're not treating the person. We need to understand that. Well, like I said, we are handling first aid, and we're talking about things that can happen at home, things that can happen in the school or in the workplace or in your place of worship. We're saying that first aid is that immediate assistance that you provide to a sick or injured person until professional help arrives. The first aider is the victim's best chance of survival, and that is very true, before medical help can be assessed. Like I said, it is not a treatment, and first aid can only be ended when professional help arrives or you transfer the victim to a hospital. I crave our indulgence. Sometimes I might be using patient and victim. That's because I'm a doctor, so it's always patient. But for the purposes of first aid, we are dealing with a victim or a person. The person is not yet a patient until the person lands in the hospital. All right, so what are the roles? Sometimes we think that the role of the first aider is like Superman or, Spider-Man, a hero. All heroes, both the ones that wear capes and the ones that don't wear capes. We think that we are the savior of the day. We are just coming to do one thing, and the person, revives, or the person comes back to life. I want us to understand that every little role you play counts. And by that, I will say every little role except taking pictures, because that is what we see these days. In the face of a medical or a trauma or an injury or a road traffic accident, people start taking pictures and start shouting, "Ewo, chai, sorry, bele," different kinds of things. A typical example is the sad event. I couldn't bring myself to watch the video, but the sad event that happened to Professor Akunyili, Dr. Akunyili, that he was alive and people were just busy videoing. So every role counts except videoing in a medical emergency. So some of those roles include calling for help, ensuring safety for yourself and for the victim, making life-saving interventions like we will see, directing or moving the victim to the right place, transporting the victim to the right place. For example, you have someone who is badly injured. You will not transport the person to a clinic. You will want to first transport the person to a facility that can take care of that level of injury. Preventing wrong interventions. When we look at drowning under injuries and trauma, you will see a situation where instead of doing chest compressions, one was doing abdominal compressions. That alone was enough to kill the victim. I remember what happened in the house. That was a couple of months ago that someone was, I think it was the NDDC guys, someone was, whether faking or it was real, don't quote me, I don't know. Someone was trying to collapse and someone was feeling like Samson and wanted to tear his jaw open. Those things are wrong interventions, and you're being at the scene of something like that, your role might just be to prevent the wrong thing from being done. Other roles include assisting resuscitation, early recognition of a life-threatening condition. You might be the first person from a distance to recognize that someone is choking. And that is because you understand your role as a first aider, like the one who recognized that Christian Eriksen had collapsed. That is the role of a first aider. Then providing vital information at the hospital. If you witnessed someone developing a medical emergency, what you witnessed could be, for example, someone was having a seizure. By the time you get to the hospital, chances are that the seizure would have stopped. But if you transport the person to the hospital and you tell the health workers there that I saw the person having an awkward, jerky movement, quickly, the doctors and nurses at the hospital realize that this is a seizure. Vital information, if you maybe brought the person out of the car and then you notice that there were some vials of drugs around where the person was, or there was something that looked like cocaine around it. Once you give the doctor that information, the person knows that he or she is dealing with a drug overdose. That changes the treatment of that patient. And I've seen a situation where two Caucasians were found in a bathroom in a club, and that was in Ghana, and they were found lifeless. and one of them was taken to a hospital where they quickly declared him dead because he was not breathing. But I'm sure if someone provided that vital information that probably they saw them with a substance, could be an opioid or something, that would change the whole dynamics, because at that point, instead of declaring the person dead, you will know that probably this person has a chance of surviving. And, that brings to memory George Floyd. In his case, I realized that he had taken fentanyl and he was constricted and all that. It's possible, I'm not saying this, it's very possible that he died from his airway being restricted, but I was rather shocked that there were doses of fentanyl and all that in his drugs, in his blood, which could have predisposed him to respiratory depression or made it more difficult for him to breathe. And I was most shocked that no CPR was done for him, either in the ambulance or when he got to the hospital. So this vital information can actually change the treatment of the patient when he gets to the hospital. Your role might not be to treat, your own might just be to provide vital information or any of the things that we've listed out here. Okay, so the next step is the first step after you know your role is to assess the scene. So let's say you see someone who has developed a medical emergency. Assessing the scene is the first step, the very first step. And in assessing the scene, basically what you're ensuring is that the scene is safe. First, for you, the rescuer, we don't want to end up having two victims. If the scene is unsafe, make sure you make the scene safe or move the patient to a safe scene rather. Some helpful tips. You need to clear the scene of harmful objects, bottles, rocks, sharps, things that could injure you or injure the patient or victim rather. Make sure we're in the middle of a pandemic, so make sure you have gloves, face masks if readily available, or you improvise. You can improvise if you see a nylon or waterproof and then use it as your glove or something. Improvise. If it's a loved one, your adrenaline will kick in quickly, and I'm sure you wouldn't have time for that. But as much as possible, make sure you think of yourself first and think of making yourself safe. You want to move away from dangerous sites, roads, burning building and fire, and you also want to switch off power supply, especially in electrocution, because if you don't do that, you will become a victim. If there's tension in the area, maybe there's a fight, like IPOB will say, sit at home. You don't want to go and save anybody. First of all, you want to stay in your house until that tension is clear, or from the area. You want to make sure you're safe. In a crowded environment, introduce yourself as you make your way to the patient. It's important. If you're a doctor, say you're a doctor. If you've been trained in first aid, say that you've been trained in first aid, because at that point, everybody's a doctor, everybody's a nurse. You might actually be doing the right thing. And because the crowd everybody in the crowd knows the wrong thing, when you're doing the right thing and if anything happens, they can even say that you're responsible for the victim's demise. So you want to introduce yourself. That gives you some leverage before you advance to the patient or the victim. Also, like we learned in Euro 2020, you can use human shields to protect the privacy of the victim and also to prevent traffic. If you remember, they mounted a wall around Christian Eriksen, and that prevented the nosy camera guys and journalists from having a picture of what was exactly going on. That is something a first aider can also do. So never say there's nothing I can do. Even if every other person there is doing something, there's always something useful you could do. Your responsibility could even be to protect the victim's personal effects, or to go through his personal effects and call a loved one. Whatever it is you think you can do to be helpful, please try and oblige yourself. All right. So assessing the victim, we said that the first step is always to make sure the scene is safe. I continue to emphasize this because so many times people in a bid to save others end up becoming victims. We don't want that. So the first thing is that you want to check for responsiveness. What do? You tap the shoulders and you tap the person very well enough and shout, "Are you okay?" You want to know whether the person would respond. The next, you want to scan the chest and check for breathing. Now, if the person is not responding, the person is not breathing, we assume that the person is in cardiac arrest. So what you need to do is to call for help and start CPR. Now, some doctors, nurses here will ask me, why are we not checking for pulse? For a first aider, we don't encourage you to check for pulse. Just go ahead, call for help, start CPR. It's only in the hospital that we insist that you must check for your pulse, because first aiders may not know how to effectively check for a pulse. If the person is unresponsive but breathing, you still call for help. You check for obvious breathing injuries, bleeding, or medical alert bracelets. Then you position the person in recovery position. That's for an unresponsive but breathing victim. And how do you know? You tap to check for response, and then you scan through the chest to know whether this person is breathing or not. Okay, so when we're done assessing the victim, then if the person is breathing, like we said, check for obvious injuries, bleeding, or medical alert bracelets. Then, depending on what you find, then you can now know what intervention to institute. We'll be looking at some specific medical emergencies and what our first aid could be. This will sound so basic to most of our doctors, but I am sure to non-doctors, these things are very important and they help us do our work in the hospital. So first we want to look at severe allergies, and let's look at this question. Can anybody read the question for me? Hello? Can someone read the question?
The child is 1 year. Non-allergic expert has of yellow fever vaccine. On your way home, he's itching all over with swollen lips and face. He's finding it difficult to breathe. What is he having, and what can you do?
All right, thank you very much. So your child of 1 year with a no allergy to air products has just received a shot of yellow fever vaccine. Sorry. So what would you do? So what is he having and what can you do? So who can answer that question? What is he having?
An anaphylactic reaction.
An anaphylactic reaction, I'm assuming a doctor has just spoken, or a nurse, or someone who works in the hospital. So our non-medical people will not understand. So we want to say that the person is having severe allergies, and we want to look at what are the things that we can do. So if you can observe this child's eyes, they are swollen, and then the lips somewhat swollen too. What makes this dangerous? So they can be life-threatening, more especially the severe forms, and it can affect any age. It can affect a child, it can affect an adolescent, it can affect an adult, and it can affect the old. So how to recognize severe allergic reactions? The underlying word there is severe. Sudden swelling of the lips, tongue, and face. Difficulty breathing, sudden itching with rashes and swelling on the body. Now I've intentionally put sudden itching with rashes as the third point here, because what we are looking at is what makes it severe. That is what we are looking at, and that is why I've ranked it that way. When someone is having severe allergies and there's swelling of the lips, tongue, and face, you need to run. You need to act fast. The reason is because these lips tell me that the person, the airway, or I could say windpipe, or I could say the channel through which air enters your body or your lungs. If it is happening around the lips, imagine when it's happening around the neck. It means no air is going in. So the lips will tell us that, the tongue will tell us that. It's only a matter of time that when the lips become obstructed, when the airway becomes obstructed, the person can no longer breathe, and that will lead us to the second option, which is difficulty breathing. It's possible the person would have developed sudden itching with rashes first, but at that point, it's still not severe. But if you do not act at that point, then the person may go on to develop swelling of the lips and the tongue, and then difficulty breathing. Now, it's so dangerous that if the airway becomes occluded, if you bring the person to the hospital, even the best of anesthetists may not be able to open that airway and breathe for the person, even the most experienced. At that point, you need to do what we call, you need to open an airway somewhere in the neck because upper part is already blocked. So it has killed a lot of people, and children, adults are at risk of very severe allergic reactions. Other pointers to allergic reactions are documented history of allergic reactions. Maybe is a child that was delivered in your hospital, or somehow the parents know that the child is allergic to seafood or allergic to drugs or to nuts, anything, food or drugs. Then a family history, and then exposure to known allergens. So for some people, it could be that they were receiving an IV, that's an intravenous drug, or a drip in the hospital that contained a drug, and then all of a sudden the itching started and it went unrecognized. Then the person develops swelling of the lips and the tongue and the face, and then difficulty breathing. So it can be a life-threatening emergency. And what you do as a first aider can really help. These are some of the signs. You can see some of the rashes. You can see swelling of the mouth. It's just an indicator that if the lips are swollen, then the airway can also be swollen. So what can we do as first aid in severe allergies? First, be calm and try to calm the patient down. One of my lecturers will say, not when you see a patient or a victim having convulsion, then you yourself, you'll be having your own convulsion. First thing in first aid is to calm yourself down, think through the things you know and go through it. Check for response, make sure your scene is safe, check for response, check for breathing. If the person is responding, if the person is unresponsive and breathing, then you cannot take a deep breath and then identify the source of the allergic reaction or identify the cause of the problem. If the person is unresponsive, not breathing, you know you need to go to a pathway, which is CPR, that we'll have a look at in our third class. So you want to identify the source of allergic reaction if possible. So if you were giving the person a drug and then the person develops that itching, you want to stop the medication. Some of our nurses are very good at that. They give you a test dose. They want to see how you're going to react before they now give you the whole drug. Now, if it is a food or a drug, you want to stop it. Next, you want to call for help. Remember, we're assuming the person is not even in the hospital. Even if the person is in the hospital or in a secluded room, you also want to call for help and draw the attention of the healthcare workers. So the best thing you can do is to use an EpiPen. It is used in severe allergic reactions and it can be life-saving in severe allergic reactions. Maybe some of us have seen it in the movie. Someone ate nuts or ate seafood or something, and then all of a sudden can't breathe anymore. The person is having severe allergic reaction. Then you see them stab themselves in the chest with the EpiPen as depicted below. That is what it does. The EpiPen contains epinephrine or adrenaline, a drug that can help reverse the swelling that will obstruct the airway. I'm trying not to use medical terms. So that swelling happening in the airway, it will help, the drug will help prevent it from worsening. That is one of the major role it is going to play. It has other roles it's going to play in helping shock and all that. But the first role, and for doctors, we need to understand this, in severe allergic reaction, of the first drug of choice is not hydrocortisone. The first drug of choice is IM adrenaline in severe allergies, because it will prevent worsening of airway obstruction. So you can see in the picture what it looks like. It's called an auto-inject pen. You just apply it on you can apply it on yourself, or you can apply it on the victim, on the thigh. Just apply it. It comes with indication on how to use it. You apply it and leave it for 2 seconds. It's going to inject a needle into it and inject the drug into your tissues. Leave it for 2 to 3 seconds, bring it out, and then you can now rub the place. It's not very painful, not painful at all. It's just a very small needle. This is actually sold in Nigeria, though it's quite expensive. Well, but it's something that if you know that your sibling or your family member or your child has very severe allergic reactions, it should be in their backpack. As a matter of fact, you should buy one and give it to their school and tell them to have it in store in case your child develops an allergic reaction. I had one of my colleagues in my workplace whose child, has very severe allergic reactions. So this becomes handy, and it could be life-saving. So your child is now fine. What steps will you take to prevent a recurrence? You have to carefully observe all allergens that your child is allergic to. You want to remove the sources of allergens from the house, car. For some of us, it's having a carpet in the house that produces dust and all that. It will lead to difficulty in breathing, and it can precipitate some allergic reaction. I have a relative who was always sneezing, having catarrh and all that. And they tried all the drugs. And I simply just told the person, remove the rug in the room. And immediately it was removed. The person felt fine. So you also need to know the sources, and then you need to remove them. For some people, it's egg. For some people, it's seafood. Some people, it's nuts. So you need to buy, when you're buying biscuit for the person, you need to make sure, does this contain nuts? This is not for everybody, but you have to do a careful assessment and identify what the problem is. If it's a child, educate the child and siblings, caregivers at home, in school, or even in the worship place. For those who have their children in Sunday school where they can even give them food to eat, you need to really educate them about this. If it's an adult, you need to educate the adults. You need to educate even close colleagues, and you need to provide them with an EpiPen. Some people, I've had calls around 1 a.m. and that was a doctor telling me that the father was having an allergic reaction to latex. Latex is the powder you see in some of our gloves. And at that point, the man was almost passing out, and there was no EpiPen anywhere. And the person had to just manage with hydrocortisone. So some of these things needs to be available. If you're a doctor, then you can have the adrenaline that you can give in your house. And for some of us who have clinics, who are doctors and all that, you need to have some of these drugs in stores, because in your neighborhood, I remember growing up as a child, whenever we are sick, we'll always, even if it's 3 a.m., we would rush to the doctor's house, knock on his door, and he will allow us come in. Now, if that was happening and the person doesn't have adrenaline in the house, then it becomes a problem. Adrenaline is a life-saving drug everyone should have. Doctors who run clinics, even if you're a doctor and your whole neighborhood knows you're a doctor, it means that automatically your house is also a hospital. Okay, and if your house is a hospital, it means it's a first aid base, so you need to be prepared. All right, so the next thing we want to look at is asthma. It's also another medical condition that can result in a life-threatening event. There's a narrowing of the airway passage, and it makes it difficult to breathe. There's also chest tightness. So it's like this. Someone is trying to block your airway, and you're still struggling to breathe. Hello? Hello? Okay. So I said, like in asthma, what happens is that you're being constricted, or there's an obstruction to you. There's an obstruction for you to breathe out. That is the problem. You're struggling, and the more you struggle, the more you're breathing in without breathing out. That is the problem. So the more you're taking in oxygen, the more it's difficult for you to even expel the CO2. And that makes it very excruciating. It makes it like your body can't understand what is going on. The more you are unable to breathe out, the more you're breathing in, which is even worsening the problem. So it results in chest tightness and difficulty breathing. It can be aggravated by cold, fumes, dust, allergies, and can be life-threatening if not addressed quickly. How do you recognize it? There might be a previous history of asthma, and then all of a sudden the person is coughing, dry cough. Person is having this whistling sound anytime he breathes. It can be like that. It may not sound like a clear whistle. Then trouble or struggle breathing, shortness of breath. The person will be unable to talk without stopping for a breath. My name is Dozie. Now the person cannot complete a sentence without a breath. Then there's tightness in the chest. There's feeling of fear, confusion, or the person is feeling like he's going to pass out, and the person might be sweating profusely. Most asthmatics know that they're asthmatic. Even though I have a colleague who just developed hers once without having a previous history of asthma, but most times they will know that they're asthmatic. So what can you do? So you call for help, you assure the victim, because that struggle is even making things worse, even though I don't know how much reassuring will do. Have the person rest in a comfortable position, losing restrictive clothing, assist the person with a prescribed inhaler, watch for improvement in breathing. If there's no improvement, or even if there's slight improvement, rush the victim to the hospital for more advanced interventions. And using an inhaler is not as simple as just putting it in the mouth and using it. If you're using an inhaler, please teach the user, if you're prescribing one or you know someone who uses an inhaler, you need to teach them how to use it properly. In one of the Dr. House, a lady was trying to show how she uses her inhaler, and she said, she puffed it by her side and said that that's how she uses her inhaler. So people need to be taught the proper use of the inhaler. When we finish, if we have time, I'll play a video that shows us how to properly use the inhaler. You have to make sure your mouth is properly covered around it. First of all, you have to exhale and then put the inhaler in your mouth, wrap your lips around it. Then as you're taking in breaths, you press it and take a puff. When you do that, you're supposed to hold your breath. As you're taking in your breath, you give that puff, the first puff, and you're supposed to count from 10 to 0, 10, 9, all the way to 0 before you can now exhale. That is the proper way to use an inhaler. And a lot of people get prescribed inhalers without being taught how to use it properly. All right, another very common medical emergency is choking. Who can read this for us? Read the question.
Dina?
Yeah, go ahead.
Dina, you observe that your husband appears to be in distress. He's choking on his food. He's unable to talk, clutching his neck. What are your next steps?
Okay. So, Adina, you observe that your husband appears to be in distress. He's choking on his food and he's unable to talk. What are your next steps and how would you offer first aid? All right. So, it's also a very common emergency. One day I was in my room sleeping and I heard my dad call out my name. The way I noticed the retch in his voice. So immediately I knew he was choking and he was having his dinner, and I had to just come sit right in front of him and I observed him. He was coughing, was really coughing vigorously. So at that point, I knew he was not severely choking. So it's a common emergency, and again, it occurs in all age groups. more so in neonates, infants, and children. But like I said, it can affect anyone. It can be life-threatening. It is life-threatening, not can be. It is life-threatening when severe. It is a common occurrence when after eating, you immediately go to lie down. I don't know how many of us have experienced that. I've experienced it several times. And boy, it feels like your life is ending right in front of you. If you finish eating, then you go and lie down, and then all of a sudden you're lying on your tummy and something comes from your stomach and blocks your airway. It's mad. Like, I can't even describe that feeling. You can't breathe. You are doing every technique to breathe, and you can't. At that point, if you can no longer talk, you can't cough, the person is not breathing, then the person is severely choking. If the person is coughing, then it's mild to moderate. Encourage the person to cough, whether it's a child or an adult. But if the person can't talk, is not coughing anymore, can't breathe, then the person is having severe choking. If the person makes this universal choking sign, then you know the person is also choking. If the person is able to talk, then the person is not severely choking. The victim may turn blue. That is what they tell us in the books. Don't count on seeing Chelsea blue color or this kind of blue color. No. Just look at the first two: unable to talk, cough or breathe, and then making the universal choking sign. Of course, infants will not be able to make the universal choking sign. Okay, so what do we do? For responsive victims, we do what we call an abdominal thrust or a chest thrust. You can see an abdominal thrust here. There's a modification here. As you can see, the woman seems to have a gravid or pregnant, so the man had to move his hands a bit up. Now, we call it abdominal thrust or the Heimlich maneuver. For infants, we call it the chest thrust and back slaps. This is the chest thrust, and you can see this is the back slaps for infants. If you are doing any of this, responsive means that the person at least can breathe. The person can respond to you. You can call the person and the person will blink and look at you. It means that the person is unresponsive. If the person is unresponsive, it means like the person is some deep sleep that you cannot wake the person up from. And you know that the person was choking, or maybe you were even doing any of these maneuvers or any of these procedures before the person became unresponsive. The next thing you need to do is that you need to call for help, and you need to commence CPR immediately if the person is unresponsive. You want to do compressions and breaths. Like I said, we'll see that in our CPR segment, and then check for obstruction before giving birth. We'll still cover that. But for the sake of what we have today, we'll focus more on how to do that for responsive victims. So for adults, children, you want to do abdominal thrust, infants, chest thrust, and back slap. So for some older children that you may not be able to hold this way, you might want to just give them back slaps while standing on their feet. So this is how we perform abdominal thrust. You want to position yourself behind the patient, place one foot forward and the other one backward. Now, this is for your own stance. You want to make sure that you are stable so that if the person becomes unconscious or the person wants to fall, both of you will not fall. You'll be able to hold the person properly and prevent a fall from both the victim and yourself. So next is that you want to place a fist with your thumb inside the navel, and then you want to cover with the thumb against the middle of the person's abdomen just above the navel. So you find the navel with your thumb, and then you just go a bit above it and make a fist. Then you use your other hand to hold it. You have to give 5 quick upward abdominal thrusts, and you continue doing that until whatever is obstructing the person's airway, the person vomits it out. You continue that. If while doing this, the person becomes unresponsive, then at that point, you want to call for help and start CPR. For children or for infants, this is how to do the back slap. For clarity, you need to sit at the edge of a stool. Don't relax inside. You need to sit at the edge. Then you hold the child face down on your arm. This is what this person is doing, face down. You want the person, you don't want the child to be straight. You want the child to be face down, slanting, so that gravity can help you. Then your fingers supporting the face. If you can see the fingers supporting the face, and you hold the child on your arm, more of forearm. So you see how the arm is holding, the child is just face down on the arm of the rescuer. The next you want to do is use your heel and to slap the back several times in between the bones at the back, or the scapula, or the shoulder bones. Yeah. Okay. So you just hit it hard. 1, 2, 3, 4, 5. Then immediately you do that, you turn the child over, face up, and support with your forearm and your fingers. So this is this step. You turn the child over, support the head with your fingers or your palm, and then your forearm. And then you locate the middle in between the two nipples, and then use 2 fingers to press down on the chest. After that, you turn the child over and do the back slaps 5. So 5 back slaps alternating with 5 chest thrusts until the child starts crying, or the obstruction that was blocking the airway, the child vomits it out, or you see it around the child's mouth. Then you can bring it. There are some precautions you should take. When a child is choking, if you open the mouth, if you don't see what is causing the obstruction, please do not put your fingers into the mouth. The reason is because if there's something and you're not seeing it, and you're doing what we call a blind finger sweep, you may push that obstruction or the obstructing object further down. Maybe the obstruction is coming out. Maybe it's a bead. Maybe it's something the child swallowed and the thing is obstructing the airway. The thing is coming out. But because you're not seeing it and you're just putting your hand to sweep them out, you might actually end up pushing it backward. So one good thing is that if you open your mouth, you can see it, bring it out. If you cannot see it, please do not put in your fingers. Okay. Any questions so far before I continue? Any questions? I'll stop sharing at this point. See if there are any questions.
Please, if you have questions, you can raise your hand or send it into the chat box.
Okay. Any questions? I would like to take questions before going to other things. Yeah.
Yes, sir. We have a question from Jemima. Please unmute yourself and ask the question.
Okay, thank you very much for your presentation, sir. Please, I wanted to ask, in the absence of an EpiPen, if I just have IM adrenaline, what is the dose I should give for someone with severe allergies?
Okay. What dose should you give? Remember I said it's for severe allergies.
Allergies, yes, sir.
Yes. Okay. So for severe allergies, for adults, we usually give 0.5 milligrams or 500 micrograms IM. And for children, depending on weight and size, we do 300 milligrams and 0.3 milligrams or 300 micrograms and 150 micrograms. Those are the doses we use depending on age. But for adults, generally, we use 500 micrograms. Get it, 0.5 milligrams and it's all IM, not IV. Sorry, I didn't know my video was off. I just realized it now.
Okay, I'm sorry, sir. Please, just to add, I wanted to ask the dilution of adrenaline. I think it differs. There's one in
Okay,
10,000 and
1 in
one. So which one are
1,000.
we using?
Right. 1 in 1,000. That is usually the original concentration. So 1 in 1,000 concentration, 0.5 milligrams. Yeah. Thank you. That's for for anaphylaxis.
All right, sir. You have some questions on the chat box. One says,
Thank
please,
you, sir.
should the EpiPen?
All right. So someone asked, okay, the slides will be made available. Can I enable my video? Yes, I will from now on. Sorry, I didn't know it wasn't enabled. Won't I be worried about aspiration? I am guessing this question is because of the demonstration of choking. Am I right? Infinix Hot 6. Okay, so I think the person is talking about, won't I be worried about aspiration? Now, aspiration will happen if the person is unconscious. If the person is still responsive, I am not worried about aspiration because it means the person can still protect. It's like when you, okay, for example, how I'll give that example is like you are sleeping immediately after eating and all of a sudden you're choking. How come you wake up and you start retching and you start cooking? It's because even though you were sleeping, you were conscious. So immediately that object was obstructing your airway, some messages were sent to your brain that your airway is blocked, and that wakes you up and then you start coughing. So if the person is responsive and the person is not yet unresponsive, if you're doing the Heimlich maneuver, the person's, the person will have, there will be a gag, irritation of the person's gag, and the person, once it comes there, the person will vomit it. When the person becomes unresponsive, chances are that the gag is no longer active, and that means the person can aspirate. So I hope that answers your question. So to recap on the steps in abdominal thrust, I will just play the video so that we can have a look at it.
Chest to their back. Place your arms under theirs.
So I'll just share my screen again and play the video so that we'll have a look at it. Can we see the screen?
Yes, sir.
Yes, sir.
Yes, sir.
Dominant hand and place it in the upper mid portion of the abdomen. Thrust upward and inward until the object is expelled. There's two things to remember. If they lose consciousness, they're going to need CPR until help arrives. And never perform the Heimlich maneuver on infants younger than 1 year old. We've got another video for that. Thanks. Then place your arms under their chest to their back. Place your arms under theirs. Make a fist with your dominant hand and place it in the upper mid portion of the abdomen. Thrust upward and inward until the object is expelled. There's two things to remember. If they lose consciousness, they're going to need CPR until help arrives. And never perform the Heimlich maneuver on infants younger than 1 year old. We've got another video for that. Thanks for watching.
So like I said, you are going to stand in front of, behind the patient or the victim with 1 foot forward and 1 foot backward so that you can be balanced. And so that if the person is going to fall, you won't fall with the victim. That is what you're going to do. Then with you use the thumb to locate the navel. When you locate the navel, you go a bit up and then you grab the other hand this way and then a forceful inward upward thrust. That is how to do it. So next I'm going to play the video of how to do it for the infants.
And I'm going to give them what we call back blows. With your baby in this position, gravity is on your side. You can see their head is lower than their bottom. And then with the heel of my hand, I'm going to give them a blow between their shoulder blades. So I'll demonstrate for you now. If it's not come out, then I'm just going to try again. and keep going until it comes out. What the back blows do is they create a vibration and pressure within the airway, which will hopefully force the object out. If they've not worked and I've done 5 back blows, then there is something else that you can try. So turn your baby over, supporting their head still, and still keeping them resting on your knee. And then in this position, with 2 fingers right in the center of my baby's chest, I'm going to give them what we call chest thrusts. And it's a very quick, fast push down. If it's not come out, again, just keep going. What the chest thrusts do is they will hopefully squeeze the air out of their lungs and push the object out of the way.
Okay. Do we understand the mechanism now?
Yes, sir.
Good.
Yes, sir.
All right. So, any other questions so that we can go back? So someone said go over the doses. Like I said, in adults, we use 0.5 milligrams or 500 micrograms. I heard in one of the hospitals in Abuja, I don't want to call a name, someone was supposed to give 1 milligram of adrenaline, and the person ended up giving, is it 10 milligrams of adrenaline? And child actually went into arrest. So please make sure it's 0. And like I said, it's for the doctors asking. It's as a first aider, you have no business giving that unless it's an EpiPen. As a first aider, you have no place giving that unless it's EpiPen. Why EpiPen is safe is that it's already calibrated. It's already calibrated, so you can't. It has about, some have like 300 micrograms or 0.3 milligrams. So no matter what you do, you can't even give more than that. All right. Okay. So those are the doses. We have 300 micrograms, 150 micrograms, or 0.3 or 0.15 milligrams. So we'll continue with the presentation. Okay. All right. So all right, so let me share my slide again. So we'll continue from, we stopped at asthma, or stopped at choking, so we'll continue. Now, before I go to the next, please observe that this victim is pregnant, so the man is doing what we call a chest thrust. It's going above the pregnant uterus or the womb and then going above it. But if this woman wasn't pregnant, then he will be targeted just above the navel or the umbilicus. Okay. So heart attack. So there's a misconception that heart attack is the same thing as cardiac arrest. It is not the same thing. In heart attack, there's an obstruction to blood flow. So the channel that supplies the blood to the heart, or the part through which blood gets, not what supplies the blood and the heart with blood, yes, gets obstructed. So you can see this, we call it by a blood clot. So what happens that obviously the road or the part or the, what we call the blood vessel supplying the heart has already been narrowed. So it's like a 2-lane road that has been narrowed to 1 lane because of bad road. So it was a 2-lane road and now everybody is using 1 lane. It means that any small accident will cause an obstruction, will cause a traffic jam. If it was 2 lanes, then the chances, if 1 lane becomes blocked, everybody can switch over to the next lane until that next lane becomes blocked. But what happens in heart attack is that there's already a narrowing to the flow by what we call arteriomatous plaques or fats, bad fats. So when that happens and another blood clot now comes, the blood clot may naturally have passed through it before because the road was wide, but now it is narrow. So any small blood clot will now come into this place and obstruct it. And when the heart is not getting blood, the heart starts complaining. And when the heart starts complaining, the heart is complaining that it is not getting blood. And what is in blood? Oxygen. So if the heart is complaining that I'm not getting oxygen, what do you think is going to happen? The heart is going to start shutting down. And the way the heart complains is to tell you that, is to elicit chest pain. And if over time the heart is not getting that oxygen or not getting blood, it starts dying. So that's why this place is called dying muscle. And you can see this place is healthy muscle. Over time, if this thing expands, it will now lead to cardiac arrest. The heart can't even pump at all. Now, so heart attack is often mistaken for cardiac arrest, but it is not cardiac arrest. If heart attack is not managed, it will result in a cardiac arrest. That is what we are saying. Heart attack is one of the causes of cardiac arrest. In cardiac arrest, the heart is not even pumping at all. And so many things can cause a cardiac arrest, of which heart attack is one of those things that can cause cardiac arrest. In cardiac arrest, the heart is not pumping blood at all. But in heart attack, the heart is pumping blood, but is complaining that it is no longer getting blood the way it used to get it. And if that is left untreated, then the person stands a chance of now developing a full cardiac arrest. Some of the very symptoms are basically what we call central or center chest discomfort. Person has chest pain or chest discomfort, and sometimes they say it radiates to the left side, it radiates to the arm, the forearm, radiates to the jaw, all those plenty things. Sometimes you may never get that. Sometimes all you get is that the person is complaining of chest pain. Now, sometimes people call it ulcer. A lot of people have died in the name of ulcer because they say it is here. Sometimes even heart attack can look like an ulcer. I've had that experience before. A patient came in, saw a doctor, and the doctor thought it was ulcer, started treating ulcer, and the pain would not come down. Next thing, the person goes, while they were still treating, giving the person the drug of the ulcer, the person goes into cardiac arrest. And the doctor is thinking, did I give this person too much of the drug, or did I give this person an expired drug? The person was just thinking all over the place. But by the time we did the autopsy, we knew that the person was having a heart attack. So now for doctors, as a rule for me, if someone comes in having epigastric pain, I will get an ECG done. The reason is because a lot of ulcers, a lot of heart attacks or myocardial infarction has been misdiagnosed as epigastric pain. So as a general rule, they should get an ECG. I've seen this happen not once, not twice, and not 3 times. In fact, it's now a regular occurrence that most of them complain of epigastric pain, and we think it's ulcer, not knowing that it's a myocardial infarction. All right. So central chest discomfort, it could feel like the person has a bag of cement on the chest, like chest heaviness, chest tightness, chest pain, then nausea. Nausea is the feeling like you want to vomit. You may not vomit, just that feeling that you may want to vomit. Then you're sweating excessively, and the person is also having shortness of breath. Now, so what can you do? I'm looking at my time. So first aid for heart attacks, you have to keep the victim calm. Anxiety worsens it. How does anxiety worsen it? It's like the heart is complaining that I am not getting more of blood. And your anxiety is now stressing the heart. The heart is beating faster, demanding more oxygen. So it's like you're increasing the work of the heart, yet you're not increasing the blood supply. What do you think is going to happen? It's going to worsen it. So you don't want the victim to walk. Give the victim a seat to sit down. Call for help and activate emergency response. Like Professor said, our ambulance service is not yet working, but if some vicinities like Abuja and all that are beginning to develop ambulance service, so what is available in your system, you can go ahead and use it. Sometimes it might be a call center that you'll call and they will tell you what to do. So if this person is not allergic to aspirin and has not been bleeding from the stomach in the last 3 days, maybe the person there's no blood in the person's stool, or the person has not vomited anything that is blood or looks black in color, or the person has not had any stool that is black in color. I'm just using this to describe what we call GI. By GI, I mean gastrointestinal, anything that shows that he's bleeding from the stomach. If the person has not had that in the last 3 days and has not had any allergies to aspirin, then you need to give the person 300 milligrams of aspirin. And you look at the aspirin, if it is 75, you give the person 4 tablets to chew. If it is not, if it is another, then if it's a big, there are some that come in big sizes, you give the person 325 to chew. Depends on what you have available. There's a way aspirin works. Aspirin, for the health workers, aspirin prevents platelet aggregation. So if you remember, think back to coagulation, how blood clots. If I cut myself now, it will bleed. After a while, it will clot. So imagine when that thing is happening in that narrow space, that further clotting, and it starts from small clots and it turns to a big clot. That is a natural response of the body to bleeding. Anywhere there's bleeding, the body tries to form a clot. Now, imagine the blood clotting within that narrow space in that artery. That is only going to worsen the heart attack. And that is why we basically give aspirin to stop further blood clotting. Aspirin is not a treatment. As you're giving the person the aspirin, please drive the person immediately to a health facility. And here I said, a health facility capable of ECG, preferably with a cath lab. I don't like sounding highfalutin, but if somebody is complaining of chest pain and you're taking the person to a clinic, you might just be wasting the only valuable time the person has. You need to send the person minimum to a place where they can perform ECG, pick up the fact that he has a possible heart attack, and take the person to a cath lab. If we had good ambulance services and you call them and you explain the symptoms, they will tell you which hospitals in your vicinity you should take the person to. Cath labs are not that common. That is why I am not placing a lot of emphasis on it. But if you're a health worker, the minimum you should do when someone comes into your hospital with chest pain is to do an ECG. If you can't interpret an ECG, you can undertake a course in it, or you can send it to your cardiologist or anyone who you know can interpret the ECG. Once that is done, you should also know the hospitals in your vicinity that can do, that have cath labs, that can do what we call PCI. This is now for the healthcare workers. You should know, like in Abuja, there are 3 hospitals I know that offer, that have cath labs, meaning that someone has a heart attack, and then I can refer them to these hospitals. In those hospitals, I know the places where they have a resident cardiologist, so that if you take the person there in 30 minutes, in less than 30 minutes, the person will get the PCI done. So you need to know people in your environment that have such facilities. All right, so we'll be rounding up so that we can take questions. So that is for heart attacks. So this is just what the ECG looks like. The ECG is necessary for you to diagnose it. If you cannot get to a cath lab, go to a hospital and request for an ECG, because the chest pain could be a heart attack. And what I do is that it's better I I do it and I discover it's not a heart attack, then I rest, then I miss it, and the person dies. That's something that I can't live with. Okay. So the other medical emergency we want to look at is seizures. Seizures are sudden, involuntary, and I will say awkward, involuntary and awkward movement. It may involve one part of the body or all parts of the body. It can be subtle, meaning that you can miss it in children, but in adults, it can be violent. So to recognize a seizure, some things you must look into is that, one, it's of sudden onset. You can see it with rapid blinking of the eye. There's jerky movement of vibration of all parts of the body or one side of the body. It can start with confusion. Victim loses consciousness, but the victim is still breathing. The victim has no, when the person wakes up, has no recollection of the events whatsoever. If you tell the person you had just had convulsed, sometimes we use that word convulsion too in place of seizures. Mean the same thing at the level of first aid. You tell the person you had a seizure, the person tells you no. The person can even fight you because you're saying something that doesn't sound correct at all. So the person has no recollection, the person is unconscious. So if you're hitting the person when the person is having the jerking movement and telling the person to stop, just know that the person is not conscious of what is happening. I've seen people I've seen people rush children to the hospital, for those that work in the hospital, these things are normal to us. And that is why this training should not be amongst healthcare professionals. We should take it to our churches. We should take it to schools, workplaces. The way non-medical people perceive some of these emergencies. Like I've seen a man, they are running frantically to the emergency. The child starts having seizure. The man is putting his fingers into the boy's mouth. The mom wants to pass out. And in my head, I'm smiling. This thing is just a simple seizure. I know what to do. But they are all over the place. It can really be challenging for non-medical people, seizures. Everything, like I told you of the child that was choking, immediately the mother realized that the child was choking. The woman abandoned the child. In her mind, the child was dead. And what they did to that child, that they bent the child, they turned the child upside down, they did all manner of things. But if you know the right practice, you just tell them, calm down, and this is what it is. Some people think it is demon possession. The people think it's different things, and that is why people put things in the mouth. People give people marks, use oil on top of the people, cut onions and put inside the person's mouth or nose. People do all sorts when people have seizures. If you have an understanding of what a convulsion is or a seizure is, you know that it's a seizure or a convulsion, and you know what to do. So the questions, let's start with the things that we should not do. Do not hold or restrain this person, please. Do not place anything between the person's teeth. Please do not. Some people are saying we place things in the mouth so that it will not clench the teeth. If the person clenches the teeth, what will happen? What happens? Then that was in secondary school, that was the belief. If the person clenches the teeth, the person will die. Some people are worried about biting the tongue. If the person bites the tongue, we suture it. We sew it together. That's not a problem. Because in a bid to put something in the mouth, you may end up pushing the tongue backwards. And when you push the tongue backwards, you further block the airway. So sometimes when we teach lay people, we need to make them understand why they shouldn't do the things they do. They should not hold or restrain the person. The reason is because the person doesn't have control over it. And secondly, you also don't have control. You cannot restrain someone who is having seizures. The seizure episode is very powerful. You do not try. You may, in an attempt to restrain the person, you will either injure yourself or you can injure the person. You can give the person fractures and you can injure the person. So the question now is, what do you do? So the question is, while driving, you notice that your colleague is having a seizure. What do you do? Now, some of the questions And some of the scenarios that I've painted are actually scenarios that I have experienced myself, and they are not things that I'm trying to paint. So you're driving and you notice that your colleague is having a convulsive episode or the person is having a seizure. So the first thing is that you need to remember safety. Person is driving, if you're on top speed or something and you're distracted, you could have an accident. So remember safety and clear off the road and stop the vehicle. That's the first, that was what I did. Then you want to clear the environment of harmful objects. If the person is having a convulsive episodes on the floor or something, you want to make sure there are no stones, no sharp objects, anything that could injure the person. You want to now protect the head. If you had something soft like a towel or a pillow you can put under the person's head. Some people are always, the jerky movement is making them hit their head on the floor. That can result in some injuries. You can put that soft pillow or soft material to prevent that. Then allow the seizure to terminate. Less than 2 minutes, it should terminate. Less than 1 minute even, it should terminate. If it terminates, place the person on his or her side to drain fluid from the mouth. The reason is that you don't want that fluid blocking the person's airway. Remember, the person is unconscious. When the seizure is over, put the person in recovery position and be sure that the person's airway is open and the person is breathing, and then check for injuries. Quickly take this victim to the hospital. Like I said, first aid does not end until you take the person to the hospital. Don't say, I have relieved choking, then the person is okay. No, take the person to hospital because the person could have sustained internal injuries even from your abdominal thrusts, just for a quick assessment. For this person who had a seizure, it's possible that the person is the first time is having the seizure, so they need to put the person on drugs to prevent further seizures. It's possible the person has not been taking, is a known seizure person, but has not been taking the drugs, or the drugs is no longer effective. So you need to take the person to the hospital so that they can effectively look at the drugs, know whether to increase the doses or to place the person on a new drug. That is why it's important that even after the seizure has ceased, you take the person to the hospital. If after 2 minutes, 3 minutes, the seizure is not ceasing, please drive to the closest hospital and they'll take it from there. All right, so we have a look at stroke. It can be caused by obstruction of blood flow to the brain or a burst blood vessel, like the blood vessels flowing in the brain, taking blood, in and out of the brain, and then one of them bursts and then floods the brain with blood. Or maybe just like we saw in the heart, something obstructs the thing supplying blood to the brain. One thing you have to understand is that time is brain. If you don't intervene faster, just like the heart, time is also heart.
In a meeting.
Okay.
Drop that thing.
Okay, so time is brain. If you do not act fast, then the stroke can start with something small and then even become worse and progress. It can start with maybe just the right arm and progress. Sometimes it starts with just half of the body. Time is brain also because you have a limited time that if it is something that is blocking the brain, if there's an obstruction to blood going to the brain, you can use something to, let me use the word, dissolve that thing before the brain dies. In advanced settings, you can use an instrument and go and pick out what the obstruction is, and then blood will continue flowing. So it's like traffic jam. If 2 cars had an accident and it's causing traffic jam, if you are able to remove those cars, the cars will start flowing. The traffic will resolve. But if you delay, the more the traffic builds up, the more the traffic, more cars are getting congested and is affecting every part of the town is grinding to a halt. So just think of it like a traffic jam. If you don't act fast, then the traffic builds up and there's a hold up everywhere in town. So how can you quickly recognize a stroke? we use an acronym called FAST. One is face asymmetry. Second is arm drifting. The third is speech impairment, or the speech is slurred. And T represents the time you need to act. So you can see this man's face and you can see the asymmetry. You can see this thing here. You can't see it here. If you ask him to smile, he will only smile with one side of the face, and the other side of the face will not be able to do anything. Then arm drift. This man is being asked to raise his arm. He can raise the right, but he can't raise the left. So when you say this and then you ask the person to say something, and it's like the person is eating corn, or the person has water in his mouth, or you can't make out what the person is saying. The person is talking, but it is not coming out. You can't hear exactly what the person is saying. If you have any of those, then you know that this person is having a stroke. It can be quite challenging. It can be quite challenging. I had a patient once that the woman was during her son's wedding that she developed a stroke, I think either in the church or in the reception, and that can really feel strange. But if you know that it is a stroke, all you just need to do is be calm, call for help, monitor and reassure the victim, make sure the airway is patent, and like I said there, transport victim to a hospital with a CT scan and a stroke care. I mean, a lot of people are going to come after me and say, how many hospitals have CT scan machine? Well, I try to talk about the ideal because I pray that one day we'll get there. And secondly, is because there are a lot of hospitals that have these things. Sometimes we put our relatives in, and thirdly is that I try to tell people what I will do if I'm in their shoes. That is how I look at it, because sometimes people have stroke. They're in hospitals where no care can be offered, and they keep them there and they aspirate. Aspiration means fluid, maybe saliva or something from the stomach enters in the airway and blocks the airway. No care is given, and then they end up dying. Some of them is that the CT scan machine is what will help us know whether what is causing it is a bleed in a rupture or a burst pipe or a burst vessel, or whether it is something blocking it. Now, depending on what it is, the treatments in the hospital are different. That is why we need a facility that in 20 minutes, you should get your CT scan done and interpreted, so that if it is the blockage, you give something to dissolve it. If it is a bleeder, you call the neurosurgeons and they see if there's something they can do about it. So that's why it's important. Keeping patients for, when people have stroke, a lot of things happen. There are a lot of practices. We take them to the church, they keep praying for them, condition gets worse, or put them in even a hospital facility where nothing is being done for them and their condition gets worse. I mean, if you don't have the funds to afford it, that is a separate case. But if you have the funds and the problem now is that the person is in the wrong place, that's something you also need to look at. Okay, so once the airway is patent, you want to monitor and reassure the victim, then transport victim to hospital with CT scan and stroke care. So one of the, looking at diabetes and hypoglycemia, one of the emergencies, or the one that we can do something about, there are a lot of diabetic emergencies, but one of them is hypoglycemia. And it's sudden and life-threatening with some very typical symptoms. So a lot of diabetics, maybe they take too much insulin, or they take some drugs. Some drugs given to diabetics can cause low blood sugar. So they take those drugs without taking their meals or not even eating adequate meals. Hypoglycemia can also happen in other emergencies, like those who have liver problems and all that. So it is a life-threatening emergency, and when it affects the brain, the person becomes unconscious. So some of the symptoms: hunger, headache, agitation, confusion, sweating, and fainting spells. If this victim, what to do? If the victim is unconscious, quickly administer sugar-containing fluids. You can give the person sugar to chew, or you can give the person Coke. Remember, I said if the victim is conscious. If the victim is unresponsive, quickly rush the person to the hospital. Because if that person is unconscious and you give the person, what you can do is to put, if the person is unconscious, you can put sugar under the person's tongue. Or you can just add a little water to the sugar, or grind the sugar and let it become granulated and put it under the person's tongue. That is the best you can do for an unconscious patient. If the patient is unconscious and you give the person Coke, the person can aspirate, and that aspiration will kill the person faster than they have low blood sugar. So if you don't have anything, grind the sugar, put it under the tongue so that saliva will help it absorb, and then rush the person to the hospital. Don't give the person fluids if the person is unconscious. So the last thing we have is we talked about recovery position when someone faints or someone recovers from a seizure. How do you put the person in recovery position? So we say it is a position in which an unresponsive breathing victim is placed to avoid airway obstruction. And what are these things that will obstruct the airway? The tongue and secretions from the mouth or even from the stomach. So if the person is lying flat, the tongue can go back and block the airway or the windpipe. If the person is lying flat, secretions can come from the tummy and then block the airway. So we're looking at what position will suit this person best. So these are the steps in putting a patient in recovery position. The first step is with the person lying flat, face up. If you've checked for response and all that, the person is breathing and has response. The next thing you want to do, look at the right arm. Look at how you place the right arm. You take it up. Then the left arm, you take it across the victim's chest. Then you bend the left knee, like so. So you flex it or you bend it. When you've bent it, you now drag the person towards you. Now, that hand that is across the person's chest will form a wedge so that the person will not fall on his tummy. So watch it this way. This leg would come to the floor and serve as a wedge so that the person will not lie on the tummy. So it's like the person is lying on his right side. So basically, recovery position is a way to make the person lie on his right side with wedges without turning face downward. So this is what you do to the hand. If you have someone close to you that you can practice with, you can easily do this. Then the hand goes right across the chest. Then the knee is bent, and then you pull the person towards you until the elbow of the left hand wedges on the floor, and then the knee wedges the patient on the floor. All right, so this is the much we will take today, and then we'll continue during the next class. So any questions?
Thank you so much, sir, for your question. Before the questions, just an information. We'll send a link towards the end of this training very soon from now. It will contain a place where you can put our emails. So the link to the site where you can access this file will be sent to our mails when it's ready. So you can fill the form as soon as it's sent. This training was initially targeted for non-medics, but of course, medics have also gained from it. I've gained a lot from this session in the last 1 hour or so. So if you have questions, can you raise your hand or type in the chat box? Thank you.
All right, before the questions, let me just play a video for the recovery position so that we'll have a look at it.
is unresponsive but with bulky objects in their pockets, it. Then take the arm nearest to you and place it at a right angle to the body with the palm facing upwards, like so. Take the other arm and bring across the chest and place the back of the hand against the cheek nearest to you and hold it there. With your other hand, lift the far knee up until the foot is flat on the floor. Once keeping the casualty's hand pressed against the cheek, pull on the far leg and carefully roll the casualty towards you and onto this side, like so. Once you've done this, adjust the top leg so that it is at a right angle. Tilt the casualty's head back so that the area remains open. If needed, adjust the hand under the cheek to help to keep the airway open. If it has not already been done, call 999 or 112 for emergency help. Keep checking the level of response until help arrives.
Okay. All right. So that was recovery position in a nutshell. All right. So take questions. All right. So I'm looking, proper way to use an inhaler. Okay. I will play that. I will also play that. Okay. Any other questions? Okay. Good. So what someone asked, what of putting glucose powder under the tongue of an unconscious patient? Like I said, make sure you're thinking of so that it doesn't become a practice to just put glucose under people's tongue. Make sure that you're thinking of low blood sugar, which is what we call hypoglycemia. Make sure you're thinking of low blood sugar, and make sure the person is breathing. At least if the person is unconscious and the person is not breathing, you have no business putting sugar under the tongue. What you should be doing is CPR. So if the person is unconscious, the person is breathing, and you think low blood sugar could be a cause of the unconsciousness, then by all means, you can put glucose under the tongue. But a little. We don't want this person to choke. Just a little. All right, I think I've answered that question. Any other questions? Someone said how to use an inhaler. Okay. Okay, so let me just play how to use an inhaler too. Sorry, it's loading.
The audio for the video is not.
It's mute. Okay.
To prime it. Using your inhaler, or if you haven't used it in a while, you may need to prime it. Check the instructions for how and when to do this with your inhaler, as they can differ depending on the type of inhaler and medicine. When you're ready to use your inhaler, stand or sit up straight. Breathe in deeply and breathe out completely to empty your lungs. After shaking the inhaler, put the mouthpiece in your mouth and close your lips around it to form a tight seal. As you breathe in through your mouth, press down firmly on the top of your inhaler to release one puff of medicine. Keep breathing in slowly through your mouth for 3 to 5 seconds until your lungs are completely full. It is recommended to hold your breath for approximately 10 counts. Finally, breathe out slowly through your mouth. If your medicine dose requires 2 puffs, you may need to wait before taking the second puff. Follow the instructions that came with your inhaler to know how long to wait between puffs. After using a steroid inhaler, rinse out your mouth with water and spit it out. It's important to keep your inhaler clean so that it works properly.